This is the story of two best friends whose journeys started on two separate continents. With similar career aspirations, eventually, their paths crossed in college. They matured together through medical school, residency, entering their respective specialties, marriages, and growing families. These besties are doctors first and will remain sisters always.
Hey guys.
Hey guys.
How's everyone doing out there? Well, we're BestiesMD.
Welcome back.
And we are here to share with you our very first episode.
Super excited.
We're very excited to share this with you. We have lots of good information for the ladies and the guys too.
Lots to learn for the guys.
So this episode is called the Nether region.
Nice.
Yes. So these are the 5 things that you need to know about the Nether regions.
Hey ladies, so we're just going to get right into it. First topic on the 5 things you need to know about the Nether regions is 1, know your body. Pretty much you just need to know the basic anatomy, bare bones anatomy of where everything is, how the pieces fit together. So this is what this is all about, best illustrated through pictures and diagrams. Okay, so the first thing to know on this diagram is the mons pubis noted at the top, also known as the mound. Very sensitive area for most women, and that's where the hair grows. Underneath that, you have the labia majora, which is the outer lips. Then you have the inner lips, which is the labia minora. So it's like a blossoming flower. Underneath that, you have the clitoris, which is responsible for female orgasms and sensation. Then you have the urethra, and that's where all the urine and pee comes out of. Underneath that, you have vagina, which is the vaginal orifice. That's where intercourse takes place, babies are delivered. And then the third hole is the anus. So ladies, take note, you have 3 different holes. 1 for the urine, 1 for the babies and sex, and 1 for the feces.
Oh. Okay, ladies, let's take a look at the internal anatomy. So as you can see at the top of the diagram, you have the ovaries. You have 1 on the right and 1 on the left. The ovaries contain eggs, which will make their way down into the uterus during your menstrual cycle. And so you can see that you have fallopian tubes, and these are what allows the eggs to leave the ovary and enter into the uterus. Now, moving down the diagram, you can see that the uterus has an internal portion of it, and that is where fertilized eggs can attach to the wall and then eventually develop into the placenta and the baby. Moving down the diagram, you see the cervix, which is the end of the uterus. It kind of forms a cup shape, and this is what dilates or opens up when you are having a baby. And then lastly, we have the vagina, which we all know what that is. Okay guys, so we went over the first out of the 5 things you need to know about the nether regions. So the second thing to know is the G-spot. Oh, the mysterious G-spot. I'm sure you've heard of it. You may have even experienced it, but the G-spot is an area within the vagina that is thought to produce powerful arousal, orgasm, and even female ejaculation. Oh, wait.
So the G-spot is thought to be a direct extension of the clitoris. For many women, orgasms are difficult to occur without direct stimulation of the clitoris. So this supports the idea of orgasms, vaginal orgasms, with direct penetration of the G-spot.
So scientists aren't really sure exactly where the G-spot is located, but it is thought that about 2 to 3 inches within the vagina on the front or anterior portion is where you can find the G-spot. So if that area is stimulated with a penis or a finger or a toy, about 2 to 3 inches, and then press forward, and you should be able to hit the G-spot.
Don't worry, women and men. G-spot eludes a lot of people, but women and men, I encourage you to explore your bodies and your mates' bodies just to figure out how everything works and fits together.
Right. And be patient. You know, you might not necessarily find it on the first time around, but just be patient and try again.
Third thing that you need to know is about aunt flow, also known as that time of the month, or better known as your period. So pretty much your period, the average time spans about 28 days, but there's some variability. 21 to 35 days with some variability based on age, stress, exercise, or even diet. So
we want to take a look at the entire length of the menstrual period because it's not just when you bleed. So this one can get a little complicated. So let's take a look at the diagram.
So at the bottom of this diagram, you have the days. Remember, the cycle can vary from 21 to 34 days. In the pink, you have the lining of the uterus, and then the blue is just your hormone levels. So your menstrual cycle starts with you bleeding. So that's your uterus lining falling off, sloughing off, and the hormone levels are low. As they peak and rise, you start to develop more nutrition and you develop the lining of your uterus. At day 14, you ovulate. That means you release the egg from the ovaries. It goes down into the fallopian tube and down into the uterus. If it is not fertilized, then that lining then starts to break down around day 28. If it is fertilized, that wonderful lining, which is packed full of nutrients, is there to give nutrients to the baby and allow for it to grow nice and big. So in short, that's your menstrual cycle.
All right, ladies, so we are at number 4 out of the 5 things you need to know about the nether regions. So number 4 is vaginal discharge. So we all have it, right? Every woman has vaginal discharge. It's nothing to be embarrassed about. It's nothing to be ashamed of. So normal discharge is usually clear or like a whitish color, and it doesn't have any odor, you know, or any bad odor, right?
So the amount and quality of the vaginal discharge can vary at various points in your life. Keep in mind with vaginal discharge, the whole point of it is to cleanse the vagina and maintain the natural balance. Around day 15, ovulation, mid-cycle area, it may get a little heavier, but that's okay, ladies.
Yeah, it's normal.
Also know that vaginal discharge changes with antibiotics, when you start birth control, when you go through changes in life, menopause, even the initiation of your period or any kind of changes with that.
Sure. So, you know, ladies, it's very important to be familiar with what your type of discharge is, what's normal for you. Anytime you see anything abnormal, though, that's when you should be concerned and at least just seek medical advice, right? So if you start having discharge that smells different or bad, if it changes color to like green or yellow or brown.
Don't hesitate.
Yeah, or if it's accompanied with pain or itching or burning.
It's not normal, ladies.
Yeah, all those things are not normal, and so you should definitely get those checked out, okay?
So the 5th thing that you need to know is your 3,000-mile checkup and tire rotation. Yes, just like you do your car. Hey, you gotta service the nether regions just the same.
Your hoo-ha, as I call it.
So it starts off with your doctor's visit.
Right. So when you go see your gynae doctor for your annual pap smear, there's a few things they do, right? So they will ask you some questions about your sexual activity and things that run in your family. They will examine your breasts. They'll also examine the nether regions.
They're all interrelated.
Right? Yeah, they're going to look and make sure that there's no signs of infection or any masses or anything, you know, out of the ordinary. And then they're also going to do the pap smear. So the pap smear looks for cancerous cells.
And ladies, I know this is the part we dread the most, but it's also the most important part, and it really doesn't have to be anything that's painful or stress-worthy. Very quick process.
Okay, so the pap smear is 2 parts, right? So there is a speculum exam. Speculum kind of looks like a duck bill, and there's metal ones. There's metal ones, there's plastic ones, and they are inserted into the
small
vagina.
ones and big ones.
Yeah, different sizes. They are inserted into the vagina, usually with some sort of lubrication, and then they're actually opened up so that your doctor can take a look at the cervix, which is the end of the uterus, and then the vaginal walls as well. Absolutely. Your doctor will take a small specimen inside of the cervix to test for...
Just a little swab.
Yeah, it's a very little swab, just to check for any signs of cancerous cells or infections as well. Then the second part of the pap smear or the exam of the nether regions is the bimanual.
Right.
So that's when your doctor will have 2 fingers inserted. Their 2 fingers, not somebody else's. 2 fingers inserted into the vagina, and it actually allows your doctor to feel for your cervix, to feel for your ovaries, to see whether they're full or tender, and then to also move your uterus around a little bit, because if it's tender, that could also be a sign of a possible infection.
And very subtle things can be picked up that way. Ovarian cysts, even endometriosis can be picked up that way. So it's very important. Don't take it lightly, okay?
Sure.
Just a couple quick things that you guys need to know. I mean, the guidelines have been changing so much. It's all over the news. Women don't know what to do anymore. But as it stands right now, we're recommending pap smears between the age of 21 to 65. And how variable it is every 3 years with a negative pap smear. But you can extend that out to every 5 years if you get a negative HPV, which is a virus we talked about earlier that causes cervical cancer, along with a negative pap smear. So those things are important for you to know. Hey, and those are your 5 things you need to know in the nether regions.
See you later, guys.